Trigger finger. Hi. Trigger finger is a condition of inflammation or degeneration of the sheaths of the flexor tendons of the fingers, and the appearance of fibrous granules, causing shrinkage of the tendon sheaths, tightening of the tendons, making it difficult to move through them, when the fingers have to be moved for contraction and stretching movements. Therefore, fingers exhibiting this condition will often be in a bent position, and the condition is therefore named in relation to the curvature of the trigger. Although trigger finger can happen to anyone, it is actually more common in women and especially in women between the ages of 40 and 60. Symptoms of trigger finger. Symptoms of trigger finger usually do not appear suddenly but progress gradually, with some observable or felt manifestations as follows. 1. Stiff fingers. The affected finger will likely feel stiff, especially in the morning. 2. Pain or soreness. The affected finger may feel pain, especially around the base of the finger, and may also ache in the palm of the hand. 3. Popping or clicking sensation. As the finger is moved, there may be a noticeable popping or clicking sensation. 4. Fingers often get stuck in a bent position. This is a common position in diseased fingers. The finger is stuck in a bent position, and if you want to straighten it, you have to use forced measures to straighten it again. Causes of trigger finger. For a particular patient, the exact cause of trigger finger is not always clear or easy to determine. However, in general, there are a number of factors that can contribute to the development of trigger finger. 1. Tenosynovitis. The main cause of trigger finger is inflammation of the tendon sheath that surrounds the tendons of the finger. This inflammation leads to a narrowing of the sheath, making it difficult for the tendon to slide over it smoothly when moving the finger. 2. Repetitive hand movements. People whose activities or occupations involve repetitive grasping movements or long-term use of fingers and thumbs may aggravate tenosynovitis, increasing the likelihood of developing trigger finger syndrome. 3. Pathology. Trigger finger often accompanies certain diseases such as diabetes, rheumatoid arthritis, and gout. These conditions can contribute to inflammation and structural changes in the tendons and surrounding tissues, making trigger finger more likely to occur. 4. Anatomical structure of the hand. Differences in the structure or shape of the hand may exist from person to person. These differences may include differences in the size, shape, or arrangement of the bones, tendons, ligaments, and other tissues in the hand. Anatomical variations in the hand, such as thickened tendon sheaths or the presence of nodules on the tendons, can make people with that condition more susceptible to trigger fingers. And these structural abnormalities can worsen inflammation and interfere with the smooth movement of the tendon, leading to trigger finger. Diagnosis of trigger finger. If you are experiencing persistent symptoms of trigger finger, it is highly recommended that you see a doctor soon. Diagnosing trigger finger typically includes a physical examination of the hand and fingers, assessing range of motion and any lumps or bumps that appear in the palm. In some cases, imaging tests such as ultrasound may be recommended to visualize the affected tendon. Treatment of trigger finger. You may have different approaches to treating trigger finger depending on the severity of your symptoms, such as 1. Rest and adjust activities. You need to give your affected fingers enough rest and even rest the hand that has the affected finger. Avoid excessive repetitive movements to reduce inflammation. 2. Splinting. You may also need to wear a splint to hold the affected finger upright, which can help reduce pain and promote inflammation and healing. 3. Anti-inflammatory drugs. In many painful situations, nonsteroidal anti-inflammatory drugs, NSAIDs, may be prescribed to relieve pain and reduce inflammation. 4. Physical therapy, yoga therapy, massage, acupuncture, and acupressure. Physical therapy exercises, yoga therapy exercises, and specific massage, acupressure, or acupuncture exercises can also help reduce inflammation, improve range of motion, and strengthen the affected finger. 5. Corticosteroid injection. In some cases, when your doctor deems it necessary, you may be injected with corticosteroids into the tendon sheath to reduce inflammation and symptoms. And 6. Surgery. This is the final solution. If conservative measures are unsuccessful, you may be considered for surgical intervention of the inflamed tendon sheath, which releases the movement of the tendons that are tight. Preventing trigger finger. To reduce your risk of developing trigger finger or prevent recurrence, you may want to consider taking some of the following measures. 1. Ergonomic adjustment. Arrange and change some details on the desk and sitting posture related to the movement of the fingers. The goal is to create conditions for the fingers to reduce stress when working, reduce the possibility of inflammation and swelling of the tendons of the fingers, and thereby reduce the risk of occurrence and progression of trigger finger. 2. Practice hand exercises. It is a fact that there are many people who work hard to exercise, run and jump to improve physical fitness in general, but do not pay enough attention to exercising their hands and fingers adequately. There are many exercises as well as support tools so you can easily train your hands to have supple and healthy fingers. 3. Limit continuous repetitive movements. When your job requires you to perform repetitive movements multiple times over a certain period of time, you need to schedule appropriate breaks to relax your hands as well as your fingers. Reducing muscle stress and reducing the risk of muscle inflammation can not only cause trigger finger, but also many other conditions, such as carpal tunnel syndrome. So, if you also have trigger finger or are at risk of suffering from this condition, to prevent and treat trigger finger effectively, understanding trigger finger, its causes and symptoms and available treatments are important for you. Either way, early intervention and appropriate disease management can help relieve symptoms and improve your quality of life. Furthermore, if you suspect you have trigger finger, it is imperative that you consult a doctor for an accurate diagnosis and appropriate and timely treatment recommendations. Wish you health. Thank you, goodbye and see you again.